Welcome to a special episode of our Monday night What Your Doctor's Not Telling You. This is a replay of a very popular event that we recently had, Peptides 101. So, peptides are all abuzz in the media. There's a lot of talk about those from influencers and on the news. JFK and the FDA are talking about this. So, I wanted to break it down for you so that you, as one of our people, have the latest and greatest information to make decisions for yourself and just be informed overall. So, let me get this set up. Okay, so here we go. Patient's Guide to Peptide Therapy. So we're going to talk about what peptides actually are, how they work, which peptides do we use in our office, how do we keep it safe, and I'm going to talk a little bit about the FDA and why has there been so much confusion over this recently. So what is a peptide? This is the first important thing to understand. So this is a short chain of amino acids. So this these are basically signals, they're shorter than proteins. They interact with your cells to talk to it and tell the cells what to do. So we have peptides in our body. This is how our body communicates internally. And now we can take it externally as well. So your body's text messages. So short, specific instructions on specific single things. So most of these, again, are not foreign. These are similar or derived from something your body already makes naturally. So think about it. Think about your cell surface and a lock on the cell surface. This is the key. This peptide fits into that receptor and creates a signal to, again, for the cell then to do a specific action. So these are targeted. This isn't destroying the whole cell or anything like that. It's very specific. They're generally really well tolerated. So patients have good success with these. Again, they're working along with your body instead of against it like drugs do. Fewer main side effects. Most of the things we've seen in our patients are minor irritants, nothing substantial. And then again, the details matter when you're using peptides. We are going to build peptides into an entire pyramid foundation. So we want the lifestyle, we want the sleep and the hydration, the nutrition, all of that in place. We want our oral supplements in place, and peptides to me really fit in next because it's going to be something you can do at home, either oral, injectable, nasal, however we're going to give it. It's something that you are going to administer at home as part of a comprehensive plan. And then up the pyramid, then we're looking at IVs, hyperbarics, PRP, ozone-based treatments, and then MDI. So it's part of a comprehensive plan when you're with us. So again, this is how peptides work. So these are your little single chain small amino acids. And this is your cell. So if you're on the phosphatidylcholine and taurine, that is to rebuild this blue and yellow lining here. That's your phospholipid bilayer. So we're trying to repair this. That's like your bomb shelter that gets damaged with heavy metals and toxins and things. So we're rebuilding the outside of the cell wall. These are different types of receptors. Then the peptide comes in here and engages like a lock and a key with these different receptors. Let's see. To create an action, it either turns on a signal down chain, it comes through the membrane into the cell to create another action. So there's just different ways these act. So how do we use them safely? First of all, we supervise all of them. So we will have a specific plan. We have specific things we're treating and goals that we are trying to achieve. So this isn't just, hey, here's a bunch of peptides, go explore with those. Vetted sourcing is probably the biggest challenge that we have had. The FDA, big pharma really wants their piece of the pie here, and it's hard to patent something that's naturally occurring. We're seeing that with the Semaglutide and the Tirzepatide. They've been able to take something naturally occurring, and since it's slightly altered, they've been able to patent those drugs and sell them. They want their hands on some other things that have been around a long time. So that's part of it. The FDA has also cracked down on compounding pharmacies. So the ones who do offer it, it's extremely expensive and hard to get. And then there's people manufacturing it. So they're adjacent to pharmacies and selling the raw product. If I go to my Instagram, I'm going to find a bodybuilder who's selling peptides. You need to be careful with that because those aren't always purified to the same standards for injectable meds that we would want from our pharmaceuticals. These are all going to be personalized to you. So, what are your goals? What are you trying to achieve? How does this fit into your plan and your budget? And are you okay injecting yourself? Do you have someone who can inject for you? And then some of these we have to cycle. So we're going to do a round or two of them, and then we're going to check in and follow up with you. These have been extremely popular. We like what we're seeing impact wise from those. So many of the peptides are investigational and not FDA approved. So again, FDA approval, I think we all question a little bit. Supplements are also not FDA approved. So just think about it that way. We use based on the evidence we have available and our own clinical expertise as part of your plan. But you sign a consent form and a waiver that you understand they're not all FDA approved. And when they are, they're extremely expensive. Very important. We had a patient last week that fell into this category that was treating themselves. This is the cancer no-go list. That is one specific cutout patient population that we are very protective of. And there are a lot of peptides we cannot do if a patient is dealing with a cancering process or recovering from that, where we don't want to stimulate pathways that would lead to tumor genesis, metastasis, or anything like that. So here's some examples of peptides. Anything that is going to stimulate wound healing is going to tell the cell to proliferate and grow. Genesis is going to lay down new blood vessels, epithelial growth factor, and then growth hormone. So a lot of the peptides come from the bodybuilders. They actually tell your body to either to release a human growth hormone or indirectly stimulate that. So we don't want those signals in a patient who had, we don't want the IGF-1s, insulin like growth factors. We don't want to send those to somebody who is dealing with a cancering process. So here's some examples on the bottom. The BPC, the TB, and the GHK copper, those are going to be in a lot of combinations. So those are going to be off limits for those patients. So the 5 categories of peptides we're going to talk about tonight are the cellular energy and longevity, brain, mood, and sleep. That's one of our favorite categories. Immune and anti-inflammatory, repair, recovery, and skin. So this is the looking good. And then the weight and metabolic, which is probably the category most people are familiar with. So cellular energy and longevity, this is our biohackers have been doing this for a long time. SS31 is actually FDA approved. So it concentrates inside the mitochondria, especially in cardiac cells, and helps to repair the mitochondria. So if somebody has a cardiomyopathy or they've had a heart attack, that heart muscle is damaged, the mitochondria goes down, we can actually give this to help repair that and improve cardiac function. So again, FDA approved in 2025. We do it off label. It's available through the pharmacy for that. This one's an investment peptide, if I do say so. MOTS-c, this is really popular. Again, this is mitochondrial. It's going to help increase energy production. This is used a lot in weight loss combinations. It improves how cells use glucose, increasing insulin sensitivity, again, driving that mitochondrial, that cellular respiration. This one you want to give with a longer needle because it does look like a little bit of a wasp bite, but some people get a pretty good energy bump from MOTS-c. The FOXOR is a little bit newer one. So if you've heard of zombie or senescent cells, when our bodies age, if the older cells don't die off right away, what happens is they think of it this way. If you have older people around and young people hang out with them, that commercial on insurance where the young people start acting like their parents, kind of the same thing. Your cells, if you have a lot of old cells, they're going to prematurely age the cells around them, leading to premature aging. So we really want those cells that have become old to just cycle out. So this is one of those peptides that may be helpful in doing that. Again, short cycles. Most of the anti-senescence or senolytic medications and things are episodic. You do once a month, something like that. So brain, mood, and sleep is probably one of our favorite categories, and this is where we started with peptides. So Semax, looks like a natural brain hormone. So brain-derived natriuretic factor, you can get that for free with exercise, by the way. So if you are not walking 20 to 30 minutes and you're taking this, you could totally amplify the effects by going for a walk and being physically active if it's possible for you. So you don't need to take a peptide to get that. Exercise is the best way. However, this is also a good way to add to that. So this is really fertilizer or stimulates the brain cells to repair themselves and better signaling. So it can help focus, clarity, mood support. So we see a lot of people who have memory issues then also become a bit depressed and have the emotional slide with it. So a lot of the peptide data that we have is actually from Russia. So as we're looking at the different peptides, when you see heavy Russian publications and things, that's because they've been leading the way on this. The Selank is another one. This one is more of a calming effect. So we're using this in kiddos who have pandas that get agitated and overstimulated. Great again for people with cognitive issues. They get anxious if their environment changes or at night, that sundowning. So this can help. And this is given as an injectable or a nasal spray. And a lot of times we'll use those two together. And if you don't have a cognitive issue, you can actually use these for cognitive enhancement to optimize performance. BDNF directly supports the body's own signaling. So again, I think it's better to get this from exercise if that's within your wheelhouse and a possibility. But if it's not, and we have to give it to you, it's a starting point at least. 2228, we are not using a whole lot yet. There's one of the peptides in this we're looking at for small fiber neuropathy. DSIP, delta sleep inducing peptide. This is one of our absolute favorites. So this is going to be good for falling asleep and staying asleep. So this is going to help someone get into those delta waves of sleep that they need to have. We have seen very good results with this, especially people who've had long-standing issues. One vial lasts 20 to 40 days, depending on the size. So really a course of it sometimes is enough to reset the sleep cycle, and then someone doesn't have to take it long term. So we want to be checking in and looking about how effective was it. Immune and anti-inflammatory, these are probably amongst our favorites. So Thymosin Alpha-1, this is one we actually can and are using a little bit more in cancer patients. It is a signaling peptide made by the thymus gland that talks to the T cells. So T cells go after cancer and balances the immune response. So none of these are just overstimulating, more about it's balancing out. So we want to reduce the inflammation and increase the immune surveillance for infections and tumor cells. So keep that in mind. This is a balancer, not an enhancer. It's not going to stimulate the immune system. So recurrent and complex infections, autoimmune conditions, as long as someone's not in a total autoimmune flare, this is something we can do. So this is approved in the US for compounding. So we get this one compounded. Thymolin, this is going to help with frequent infections with aging. So we can give this one as somebody is aging, if they are starting to get sick a lot or need some more aggressive immune function, we can add this one. Thymogen is going to be a little bit similar to that. These all they're derived from the thymus gland and work in certain ways. Again, you can see a lot of these are coming from Russia. We're leaning on their experience and publications research to develop in protocols. KPV is one of our favorites. So this is a small fragment of an alpha melanocyte stimulating hormone. So it's going to calm inflammation. And where we have seen this, there's two specific places in the gut. So BPC 157, we're going to talk about, and KPV together in the gut to help with autoimmune conditions, gut healing, irritable bowel, inflammatory bowel disease, things like that. These are great together. There's a little bit of concern that this BPC and TB500 all have a little bit of antimicrobial. So if a patient has an undiagnosed Lyme condition, they can tend to herx a little bit if we give this and we don't prepare for that. So again, great for gut inflammation. We're also using this with allergic reactions. So for patients who are taking a blend, adding KPV will reduce the local irritation from those injections. So we like this one a lot. Mast cell, inflammatory conditions, things like that. So this one's more anti-inflammatory than growth promoting. So it's in a lot of the blends, but the blends are going to be off limits because of the other ingredients. So BPC 157 is probably one of the most popular, most common that we see, most widely available. So body protection compound. This is a peptide that was found in the stomach, heals the gut lining, heals injured tendons, ligaments, but it also supports new blood vessel growth. So it supports that angiogenesis to help with wounds. Great in wounds, not so great if you're dealing with the cancer process. So again, we're going to use this in gut healing. So reflux, ulcers, inflammatory bowel disease, irritable bowel, SIBO, SIFO, things like that. We're going to incorporate this into our training or into our treatment. Also Lyme. This may be something we will incorporate in some of our Lyme patients. So this is an injectable and an oral. Lots of formulations this comes in. TB500 is another one that comes from the thymus gland. This is thymosin beta 4. So it is going to help cells migrate to injury, build new blood vessels, and support tissue repair. So you can actually inject TB500 directly into wounded tendons and ligaments to expedite repair. Generally, we're going to combine the BPC 157 and TB500. That together is called Wolverine. And say you have a wrist injury, I'm generally going to have my patients inject it in that arm so that it's close to it. But I think it's a little bit challenging for a patient to inject their own tendons or ligaments directly. So if we can get it into the same limb as the injury, we're in good shape. So TB500, great product. I have a little bit of knee discomfort from time to time from an old injury and took it away like that, 30 minutes. GHK copper, so we're building here the BPC, the TB500, those two together, a Wolverine. Now you add GHK copper with those two, and that's where we get Glow, which is one of our very most popular blends that we have. So this is bright blue because it actually has copper in it. It is going to signal the skin and connective tissue. It helps with fine lines and wrinkles, so the appearance of the skin, boost collagen, wound healing, blood vessel growth. So again, we're going to add Glow to a lot of our injured patients to help repair. Can't use it in cancer. Now, this one comes in a lot of different formats. So injectable is the most common we have. We have skincare that has just the GHK copper in it. It also comes in different formulations for the hair. It'll increase hair growth. So all around, great aesthetically. Cancer, not so much. ARA 290. So this is the one that we're really looking at for neuropathic pain and small fiber neuropathy. Comes from EPO and calms inflammation, supports nerve repair. So this is on our short list of things that we're bringing in. Our neuropathy program is pretty strong. So having extra tools in our tool belt is definitely something we're interested in. Cardilax, we've used in a couple of patients. This is going to help stimulate cartilage regeneration. So those, again, bad joint injuries, or if you're told bone on bone, this may be the last ditch effort to try to delay joint replacements or surgery. Short peptide to turn on cartilage and connective tissue repair. So okay, so here is a recap of the blends. So again, Wolverine is our base blend, BPC and TB500. Glow adds the GHK copper. You take that, we add KPV, now we call it Clo. So those are our most common ones. And then the oral BPC 157 and KPV, again, very popular for gut healing issues. Can all be used in Lyme related and infections too. So weight and metabolic, this is probably the category you're most familiar with. Semaglutide, we've actually moved on from semaglutide. So this is your GLP-1, curbs the appetite, slows gastric emptying, improves blood sugar, helps with weight loss. So it's commercially available as Ozempic and Wegovy, and they had a shortage out of the gate. So that opened the door to compounding pharmacies. You guys know they ran with that. It made it accessible to people. That door is closing a little bit as the pharmaceutical companies say, hey, we've caught up and now we're going to sell it directly to patients. So this you'll see on those government sponsored websites, discounted programs. Tirzepatide is where the money is for us. These are the by far best tolerated, best weight loss that we have seen. It has two gut hormones, so it's glucagon-inducing peptide and GLP-1. So you get two different, you get the stronger appetite control. So that food noise that circulates in your head, if any of you are like, what's in the fridge? What am I eating next? When's the next meal? When do I get a snack? That food noise, that just quiets completely when you're on Tirzepatide. Blood sugar alone, it's great for that. It's approved by the FDA for type 2 diabetes. We're using it for metabolic health. Again, it opened the door to compounding pharmacies. So we get it from compounding pharmacies instead of, and some of our patients are on Mounjaro or Zepbound. So we try to find the best way for you to get it. And that's the way we get it to you. There is a black box warning for MEN syndrome. So patients with a rare endocrine, pancreatic, pituitary, and thyroid gene, they can't do these. Retatrutide is one of our favorites as well for patients who plateaued on Tirzepatide. It actually adds a third mechanism, increasing energy expenditure. So it actually increases the fat burn. This one, better for weight loss, a few more side effects. So a lot more nausea, it's stimulating. So patients can have a little bit of tachyarrhythmias or heart palpitations with this one. So we do need to watch it, but good medication for weight loss for patients who have plateaued. Cagrilintide, this is going to help signal fullness, slow the stomach emptying so patients feel full longer and they get that signal to stop eating. This is again investigational. We do have access to it. This is great to pair as part of a comprehensive plan. Now the orals, or no, this is tesamorelin. So this is going to be really good. This is that IGF-1. This is going to indirectly lead to human growth hormone, signals the pituitary to release. This is actually FDA approved for HIV, like wasting, where they had the increased abdominal fat, but they had the muscle wasting. So we don't use it for that, but we can combine this with our weight loss protocols to help with body recomposition, right? Those elite athletes that need a high muscle mass to perform and do what they want to do as they're aging, this is something we're going to incorporate with them. So reducing fat and increasing muscle mass is the key for them. So tesamorelin, there's also sermorelin. There's a few in this category that we have. And again, it's mostly reserved for those elite operators and athletes that need the stimulation. Now we get to the orals. So 5-amino 1-MQ. This one basically increases NAD. So it's for fat burning and increases energy. Some people get a little overrated on it, but I think it's overall a positive. Tesofensine is going to be a little bit different. For somebody who has an OCD for food or taking antidepressants, this may be something that can cover all those bases for them. Appetite suppression, weight loss. This is again orally available, can affect the mood. So we watch patients pretty carefully when they go on this. The next one is Sloop. This one helps to maintain a healthy body mass. So looking at preserving muscle. This one's orally available and boosts mitochondrial activity and fat burning. So again, the orals alone probably aren't going to move the needle a lot, but combined with some of the injectables and the GLPs as part of a comprehensive plan and diet, of course, and movement can be helpful and supportive. So peptides are great. They are not fix-alls for everybody. Again, we have to build on the basics. We have to get the base of the pyramid solid in order for peptides to come in and really do their best work. This is going to be individualized to your care and your goals. We're going to make sure you don't have a contraindication to any of these. And I tend to be very cautious in cycling them and monitoring and making sure we're getting, especially on the GLPs for weight loss. You guys know we have a rigorous monitoring process where patients are coming into the office. We're looking at skeletal muscle mass, and we are aggressively counseling. If someone's losing a lot of skeletal muscle, we are talking to them about changing their diet, getting their aminos in, getting their protein in, getting their exercise or resistance training in so they're building muscle, because we really don't want weight loss. We want body recomposition adjustment. We want to optimize that. And again, this is used in courses. So one peptide one time probably isn't going to do a lot, but if you use the combinations and sequence them and use them for the indications you're looking for, you'll have really good outcomes. So again, individualized dosing. Some people want to do every day. Some people want to do as few injections as possible. So we will customize that for you. We want to know about side effects, especially injection site reactions. Sometimes we have to start really low with patients and go up slowly, or sometimes they just don't tolerate, especially on the blends. If there's one piece of the blend they don't like, we may have to pull that out and do a different blend. Monitoring and follow-up, as always, these are exclusively available to our patients. So we're checking in every 1 to 3 months to track the response and make sure we're getting the benefit we want with the minimal risk. Again, these are not for everyone. We don't use them in active cancer. Some of them, we don't use these in pregnant patients. We use them very sparingly and cautiously in pediatric patients. If you want to get started on peptides, you start with a consult. So if you're already our patient, you just ask about it at your next visit. If you're not our patient, you can have a consult and you can come in and have a discussion about that. Next, you're going to get a workup and some labs. Speaking of labs, behind me, they're getting excited here. But you want to have the whole picture. We want to know, where do we have levers to move before we get started? There's no point in spending money and investing in a peptide if your vitamin D level is too low. So we want to get all of those things optimized before we get started. These are going to be personalized plans that are going to be followed and tracked over time. Drop your questions below. We had a ton of good questions on the live version, but of course, this is a retake and a redo. So let us know what questions you have about peptides. We love talking about them because we're seeing such powerful outcomes in our patients. And as we get more familiar, we can really use them to hone in on the physiology and talk to the cells and tell the cells what we want them to do, which is, again, a powerful therapeutic. So thanks for tuning in. Till next time I will see you in the next episode of What Your Doctor Is Not Telling You.